Imagine you are working at a medical clinic and the patient says, my doctor referred me to a specialist because of my chronic condition and I need to schedule a follow up appointment. Would you understand exactly what the patient needs? If you are preparing for a medical receptionist or virtual medical assistant job or an interview, understanding common healthcare terminology can make you sound more confident. In today's video, we are going to learn 15 essential medical terms every healthcare receptionist should know. So, uh, let's let's start it. So, welcome to our channel, which is Healthcare Skills Hub, where we help you develop practical skills for careers in medical reception, patient support, and virtual healthcare. We will start from term number one, which is a symptom. A symptom is something a patient experiences or reports that may indicate a health problem. Headache, pain, dizziness, nausea, fatigue. Patient says, if I have been experiencing headache for 3 days. So patient is describing a symptom. Remember, a medical receptionist should document and or communicate information according to clinical procedures, but should not diagnose the patient. What is a diagnosis? A diagnosis is the identification of a medical condition by a qualified healthcare professional, which is based on the patient's history, examination, and other relevant information. What is acute? Acute generally describes a condition or problem that begins suddenly or is short term. I want to add here that a receptionist does not make a diagnosis. Your role is to accurately handle administrative information and communicate within your scope of responsibility. Chronic. Chronic generally describes a condition that lasts for a long time or continues over an extended period. Primary care provider. Primary care provider or PCP is often called a PCP is a healthcare professional who provides routine or ongoing care or may help coordinate a patient's healthcare needs. Specialist. A specialist is a healthcare professional who focuses on a specific area of medicine. Cardiologist, dermatologist, neurologist, orthopedist. These are the specialists. What is a referral? A referral is a request or direction for a patient to receive care from another healthcare provider or a specialist. For example, the patient needs a referral before seeing a specialist. Do I need a referral to see the specialist? Yeah. Let me check our records and the provider's instructions, and I will guide you on the next step. Notice that the receptionist doesn't guess. When you are unsure, verify the information with the appropriate source. Prescription. A prescription is an authorized instruction from a qualified healthcare professional for a medication or treatment. Receptionists should follow the clinic's procedure when handling the prescription-related calls. They should not provide medical advice or change medical instructions until and unless authorized within their role. What is a medication? Medication refers to a drug or a medicine used to prevent, diagnose, treat, manage a healthcare condition. I'm calling because I have a question about my medication. I'll make sure your message gets to the appropriate clinical team. What are the vital signs? Vital signs are measurements used to assess basic body functions. For example, blood pressure, heart rate, respiratory rate, temperature. In many healthcare settings, clinical staffs are not receptionists. They are responsible for obtaining and interpreting the vital signs. As a receptionist, you may simply encounter the term in the patient's chart or workflow. Medical history. A patient's medical history is the information about their past and the current healthcare conditions, treatments, surgeries, medications, and other relevant healthcare information. Follow up. A follow up appointment is a visit scheduled after an earlier appointment, or the first appointment, or second appointment, or the next appointment, or treatment to evaluate the patient's progress or continue care. The doctor would like to see you for a follow up in 2 weeks. Lab test. A lab test is a test performed on a sample such as blood, urine, or other body material to provide information about the patient's health. The patient needs to complete their lab test before the follow up appointment. What is imaging? Imaging refers to the tests that create pictures or images of the structures inside the body. For example, the X-rays, ultrasounds, CT scan, MRI. Procedure. A procedure is a medical or healthcare intervention performed for diagnosis, treatment, or other healthcare purposes. As a receptionist, you may be responsible for coordinating appointments or providing administrative instructions related to the procedures, depending on your role and your organization's workflow. Now let's put some of the terms together. Hi, I was referred to a specialist by my primary care provider. I need to schedule a follow-up appointment, but I'm not sure whether my referral has been received. Receptionist says, certainly. May I have your full name and date of birth? That's the identification, so that I can review information. Yes, my name is David Miller and my date of birth is June the 12th, 1985. Thank you very much. Please allow me a moment while I check your records. So notice how the receptionist used several important healthcare concepts. Patient, primary care provider, PCP, referral, specialist, follow-up appointment. Understanding terminology helps you follow the conversation and know what information you need to verify. Let's review the 15 terms we discussed. Symptom, diagnosis, acute, chronic, PCP or primary care provider, specialist, prescription, medication, vital signs, medical history, follow-up, lab test, imaging, procedure. Okay, so I have a question. A patient says, my doctor sent me to a cardiologist. What is this most likely called? A diagnosis, a referral, a prescription? You can answer me in the comments. I have another question as well. A patient says, I have had this condition for many years. Which term may describe a long-term condition? Acute, chronic, follow-up. So here's something important to remember. Learning medical terminology doesn't mean you need to become a doctor. As a medical receptionist or patient support specialist, your job is to understand the language and used around you, communicate accurately, and know when to direct a question to appropriate clinical professional. You don't need to diagnose. You need to understand, communicate, and coordinate. So we have these three words: understand, communicate, and coordinate. So today you learn 15 medical terms that can help you communicate more confidently in healthcare environment. Try writing these terms down and practice them regularly. The more you hear and use them in context, the easier they will become. If you are preparing for a medical receptionist, patient support specialist, or virtual medical assistant career, subscribe to Healthcare Skills Hub for more practical healthcare training. And don't forget to watch our other lessons on patient calls, appointment scheduling, HIPAA, and healthcare interview preparation. Thank you for watching Healthcare Skills Hub. I will see you in the next video. Bye bye.